Good, happy Tuesday evening, January 5th, 2021. I'm Riley King, and welcome to the Riley King Newscast, right here on the Riley King Network. We have a lot of news to get to this Tuesday evening, so let's begin. First up, we begin with COVID-19 updates. COVID-19 in New Hampshire. New information, data, maps, and graphs. Let's take a look at that right now. And here is a look at that information for all of you right now. There are 47,328 number of people in New Hampshire have tested positive for COVID-19. 20,782,635 number of people in the United States have tested positive. 781 number of deaths from COVID-19 in New Hampshire. 916 number of people have been hospitalized with COVID-19 in New Hampshire. 353,069 number of deaths from COVID-19 in the United States. And let's take a look at this map of New Hampshire where current cases of COVID-19 are. In Manchester, 674. Let's take a look at this map of New Hampshire where total cases of COVID-19 are. Manchester, 7012. And now let's take a look at these three charts here. Let's start with the first chart here. New cases each day in New Hampshire in the purple, daily new positive COVID-19 cases. Orange, new hospitalization, and red, deaths. Let's take a look at this chart here. Current cases in the purple, total current COVID-19 cases. Orange, current hospitalization. Let's take a look at this chart here. Total cases in the purple, total positive COVID-19 cases. Orange, total hospitalization. Red, deaths, and blue, recovered. Let's take a look at this chart here. Positive PCR test rate, positive PCR and antigen test rate, and daily PCR test. Let's take a look at this chart here. Age group of cases, and female and male of cases. And let's take a look at this chart here. Infections, hospitalizations, and deaths. And let's take a look at this chart here. Deaths, percent of New Hampshire population, race/ethnicity of cases, and hospitalizations. And a reminder, common symptoms: fever, lack of smell, cough, chills, difficult breathing, nausea, vomiting, and diarrhea. How it spreads, and prevention tips. And be sure to stay with the Riley King Network for the latest of your COVID-19 information. New Hampshire's vaccine timeline prioritizes health care workers and those at high risk. State health officials outline timeline stretching into summer. Let's take a look at that video from Governor Chris Sununu's COVID-19 press briefing. Let's listen in.
Hey guys, not sure if you've heard this or not, but if you do not have a speeding ticket and you haven't had a DUI, you can get your car insurance for as low as like $19 a month.
Today we're prepared to announce which groups will be included in Phase 1B. We have a slide to share that information with all of you. So Phase 1B is going to include those people who are over the age 75 and older, individuals who are medically vulnerable at significantly higher risk, with having 2 or more conditions that are on a list that we will make available on our website. These types of conditions include conditions such as cancer, chronic obstructive pulmonary disease, certain heart conditions, obesity, pregnancy, sickle cell disease, and others. So we'll make that available online. We're also going to be opening vaccination to staff and residents of facilities that serve the people with intellectual and developmental disabilities as well, and corrections officers and staff working in correctional facilities. So that's Phase 1B. We're not there yet. We're at Phase 1A, but we're letting you know who we're going to get to next, and we're going to let you know when we get to Phase 1B. We're also ready to share with you the rest of our allocation plan after Phase 1B. Next slide. So the next phase after that group We're looking at an approach of trying to get the people who are most at risk for developing severe complications of COVID-19, including hospitalization and death. So much of our strategy is based on the age of those individuals and whether or not they have medical complications. So in 1B, we're doing those over the age of 75. In that next group, we're going to do 65 to 75 years old. And we're also going to include our K through 12 school staff and child care staff. Next slide. 2B then will naturally come the 50 to 65-year-old individuals. And then 3A will start to include those people under the age of 50. But before we open it up to everyone under 50, we want to try and get those people who are at moderately increased risk for developing severe complications of COVID-19. And again, we'll be looking at that list of medical conditions that we will make available online. And then the last slide will be everyone else who hasn't yet been vaccinated. And we expect to start vaccinating those broader groups under the age of 50 several months from now, late in May or into the summer months. Okay. So in terms of how people are going to receive their vaccine, next slide. Vaccines for people in these groups are going to be administered in a variety of settings that include hospitals, healthcare provider offices, pharmacies, and our state-run fixed sites. If supplies allow, we want this vaccine to be as easy to get as the flu shot. So what you need to do then, going forward, is to keep your eye out for information that we'll be sharing with you as we open up to each of these next phases, looking at information on our website, as well as information from your healthcare provider, who we're going to lean on to help us vaccinate those people who are at high risk for complications, those people who have medical vulnerabilities. It's going to, again, take us several months to get everyone who wants to be vaccinated. And this means, again, as Dr. Chan said, that we must remain vigilant in taking those steps as individuals to prevent COVID-19. Thank you.
Okay, and there you go from that briefing. That briefing took place today at 3 p.m. And again, if you missed that, the vaccination timeline, you can see this link on the Riley King Network Facebook page right after this broadcast. Sununu on President Trump calls with Georgia official. I was pretty shocked. Governor says he understands president's frustration. Let's take a listen to that video from WMUR News 9, Adam Sexton.
Taught me how to drink.
I think when I both read the transcripts and heard the phone call, like most people, I was pretty shocked at what was being discussed and some of the requests that were being requested of the Secretary of State of Georgia. I understand there has to be frustration for the president. He lost the race. He lost it in a variety of states that he's looking for. His legal options seem to have dissipated. So while I appreciate that frustration, as governor of New Hampshire, I just got to take care of what's going on in New Hampshire. And you don't want anything, clogging the wheel. Things have to move forward in Washington. We have to get past this. My sense is, and I think most people believe, Joe Biden is going to be sworn in on January 20th, and that's where we're going. And so we have to start working with the new administration moving forward. And so, yeah, I think it was quite interesting, obviously, what we had heard on that phone call.
Okay, and there you go on that video and that report. State Senate bill would let lawmakers postpone local elections. Bipartisan bill could delay elections to as late as July. Let's take a listen to that video from WMUR News 9.
You're up early.
U.S. Cellular is giving away the latest phones for free with no hidden requirements, so I did not want to miss it.
Actually,
towns across the Granite State may get some more flexibility in how they hold town meeting day this year because of the pandemic. A bipartisan bill in the state Senate would allow towns and school districts to postpone their March elections until as late as July. Elected town leaders or school board members would continue to hold their seats until those delayed votes. When COVID-19 hit New Hampshire last year, there was some confusion over whether it was actually legal to postpone the meetings.
Okay, and there you go on that video and that report. Conway police seek tips in Cadillac converter theft case. 4 trucks and older vehicles were targeted. Police in Conway said they are investigating multiple instances of stolen Cadillac converters. Targeted vehicles were parked in front of businesses along East Main Street in Center Conway and Eastman Road in Redstone in the early morning of December 31st. Conway police said the Cadillac converters were stolen from older vehicles and Ford trucks. We believe this is due to high scrap value, the department shared in a Facebook post. Officials and officers believe the Center Conway incident occurred between 4 and 5 a.m. and the Redstone theft happened between 3 and 4 a.m. Anyone with information about the case or if they have relevant surveillance footage is asked to contact Detective Jonathan Hill via phone at 603-356-5715 or email at jhill@conwaypd.com. ABC's Dr. Jennifer Ashton on COVID-19 variant vaccine rollout, vitamin D treatment. Let's take a listen to that video from WMUR News 9, Amy Cavino.
Joined now by ABC News Chief Medical Correspondent Dr. Jennifer Ashton today to talk about the latest on COVID-19 in the United States. Thanks for doing this, Doctor. Let's start with the latest on this new variant that's now showing up in the United States. What are we learning about it, and how easily does it spread?
Well, first, let's take a big picture view here. Viruses mutate for a living, so simply the announcement that there's a new variant or more, this virus has mutated at least 23 times since we became introduced to it. Not every mutation or variant makes it worse, but there is some evidence in the UK that this new variant is more transmissible, much more transmissible by about 50 to 70%. Scientists still looking into that, but if that is the case, that is a massive concern here just based on sheer numbers. More people infected will mean more hospitalizations and more deaths, so that's a concern. They're also going to be looking at whether or not the new variant is still susceptible to the vaccine or to natural immunity for people who have had other strains, other variants of SARS-CoV-2. So still a lot to learn, still a lot of unknowns, but there are some concerning features here to be sure.
You touched on this, Dr. Ashton, about whether the current vaccines might work on this new variant. That still remains to be seen, is that right?
Well, right now there's no indication that it doesn't, but they are actively looking at that, and that brings into the forefront a bigger question, which is that here in the United States, we are doing the genetic sequencing, it's called, which is really looking at the genetic fingerprint of the viruses that we are seeing. Less than 1% of all specimens. So it's hard to respond to something if you don't know it's there. So when you hear about isolated case reports of this variant has been found in this state or that state, every infectious disease, public health, and epidemiologist that I've spoken to has said, if it's in the UK, if it's in Canada, it's here, and likely in very large numbers. We just aren't doing the kind of surveillance that we can pick up on that.
Some people in priority groups are starting to get their second dose of the vaccine right now, but the rollout has seen some bumps nationally. How can those be smoothed out?
Well, we've been saying this for a while. You know, there was the science and the timeline for the discovery of a vaccine, and then the manufacturing, which was done in series and parallel to save time. And then there was the rollout, and the steps in the rollout not only involved shipping and distribution, but administration. And to be crystal clear, we need to ramp up the pace and do it quickly if we are going to make a dent in the approximately 300,000 new cases of COVID that we're seeing in this country every single day. So yes, it's important to have those groups and those phases, but there's a lot of vaccine right now sitting in a lot of freezers around the country that could be going into people's arms who want it, and we need to figure out a way to operationalize that system in a much better and more efficient way and do it quickly.
And Dr. Ashton, we're just coming off the holiday season, of course, and there are concerns about that lag, seeing a spike 2 weeks after the holidays or more. How long before you think we might see that holiday surge?
Well, there's always that lag, so it's typically around 2 weeks after exposure that you start to see those numbers go up. But again, we're talking about an incubation period of up to 14 days. People who traveled last week should either be tested or quarantined or both. Do as much as you can, do more, not less, because there is so much COVID right now in the community, in households, and people getting sick. And then you talk about another 2 to 3 week lag time for hospitalizations and then deaths after that. So we may not see the true effect and impact of holiday travel and get-togethers and celebrations until the end of January. And where we are right now is in critical condition. So it's hard to imagine those numbers getting worse.
Yeah, frustrating indeed. Can I ask you about vitamin D and COVID? Been seeing some medical headlines about it. A couple of things, that people catching it seem to be low in vitamin D, and also that vitamin D can help people fight it off.
So we've talked about that a lot on our show, GMA3, What You Need to Know. From the beginning of this pandemic, there are clinical trials ongoing and a lot of research ongoing about the effects, possible effects of vitamin D3 on COVID. There is existing data about the vitamin's effects on reducing the risk of other respiratory infections in terms of the way it reduces inflammation and improves our immune function. But right now, there is no verdict, no official recommendation that vitamin D can prevent or treat COVID-19. What we do know is that a lot of people who have died of COVID-19 are also, by association, in groups that tend to have low levels. So black and brown people, people who are obese, the elderly. And so we have to make our observation and association in medicine and science first before we start to go to cause and effect. And right now, there's no existing causation that recommends any kind of connection between vitamin D3 and COVID-19 prevention or treatment.
Got it. One last question. You talk about there being so much COVID in the country right now, and now this variant strain and sort of the bumps in the vaccine rollout. I think a lot of us in the general public were looking ahead to, maybe early summer of things sort of normalizing. Is this just going to extend that timeline?
No one has a crystal ball, and I'm included in that. I speak to Dr. Anthony Fauci on a regular basis and other top public health officials. And, right now it's just premature to look too far down the road when we have a situation right now in the present that we need to address. And so much needs to happen between now and then. So as people try to get their vaccines, right now, just control what you can control, which is meaning postpone or delay or reschedule anything that's not essential right now. You don't want to take any chances at this point, especially with a vaccine so close for so many people.
So close indeed. Dr. Ashton, thank you so much for your time this afternoon. We appreciate it.
Thanks for having me.
Okay, and there you go on that video and that report. Good information there. National Guard helps with vaccination distribution efforts. Guard members have been helping in various ways throughout the pandemic. Let's take a listen to that video from WMUR News 9, Ray Brewer.
Get convenient COVID-19 testing from Quest. Order at questcovid19.com.
Our mission is really simple. It's to save lives and mitigate human suffering.
However, in 2020, that took on a whole new meaning for the New Hampshire National Guard.
Never have we ever, provided support for the New Hampshire Food Bank, provided PPE distribution, COVID testing, vaccination support.
As the state's unemployment rate skyrocketed, the Guard also helped with phone banks set up by the Employment Security Office. But there was one recent mission that really struck a chord with the General, deploying the Guard to assist with a COVID outbreak at the Veterans Home in Tilton.
The veterans just wanted to sit next to a soldier in uniform and just talk to them about their time in service. And that I found extremely heartwarming.
Currently, the Guard is providing assistance at 13 vaccination clinics for first responders around the state. The Guard is also planning to mobilize at least 50 more members by the end of the week to provide additional assistance, and is planning for when the vaccine is made available to the general public.
I think we'll be using both our hospitals and these fixed vaccination sites to handle the general population.
And there are the traditional missions, such as getting ready to send soldiers and airmen overseas, some of the deployments lasting 9 months. Still, the General anticipates there will be more COVID-related missions, which they stand ready to execute.
I don't think any of us ever expected we would be doing this, but it's an honor to do it, and we're happy and thankful to help the fellow citizens of our state.
2/3 of the Guard are part-timers, and the General says without the support of their families and their employers, carrying out their missions would be impossible, and he's very grateful for that support. Reporting live, Ray Brewer, WMUR News 9.
Okay, and there you go on that video and that report. And that does it for this evening edition of the Riley King Newscast, right here on the Riley King Network. Thank you for watching. Have a great rest of your evening. I'll see you back here tomorrow for another newscast. I'll have a news report coming up in a little bit. Good night and goodbye, everyone.